right. Good afternoon, everyone. My name is Austin Afshar. I'm a physical therapist and clinic director at Spear Physical and Occupational Therapy's Park Slope location. I'd like to welcome back those of you who have attended one of our previous webinars, as well as welcome those who are joining us for the very first time. We appreciate you all taking some time out of your busy days to learn with us. For those of you who don't know who we are, Spear is a private outpatient practice that has been around for over 20 years with currently 20 locations located all over the New York City area. We have successfully continued to offer in-person care through the COVID-19 pandemic, as well as have launched Spear Live for those who are looking to stay in and receive care using our telehealth platform from the comfort of your own home. In our clinics, we're strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more information out about those safety measures by visiting our website at spearcenter.com. We're here for you in whichever way makes you feel the most comfortable. If you're looking for individualized care, either in the clinic or through our telehealth platform, please reach out to us at your convenience and we'll get you set up with an appointment right away. We're also going to be putting our contact information up at the end, so stay tuned. You'll see our direct emails. So in case you do want to get set up with one of us, we'll be happy to coordinate that for you. All right, so let's get a little bit to what we're going to be doing today. So we're excited to be with you today to discuss common running injuries. As it starts to get a little warmer out, more people are beginning to reintroduce running into their workout routines. And in an ideal world, every step of every mile would be 100% pain-free. The reality is that many runners deal with slight or not so slight disturbances, a tender foot, tight hamstring, whiny knee, you name it. So while these nagging issues are annoying, they can get even more annoying if you don't know how to address them, and that's what we're here for today. As part of the session, we will be talking through and demonstrating some of these exercises, and we welcome you all to follow along and practice with us if you feel comfortable. Please note though, if you're experiencing any pain while performing any of these and/or you feel unsteady or unsafe doing them on your own, stop, reach out to us directly so that we can be of support to you. All right, so before we get into it, I'd like to go over a few housekeeping things. So as you can see, or as you will see, we are coming to you live from our homes and clinics. I personally wish I was on a beach, but that won't happen for a while. And although we don't anticipate any technical issues today, we ask that you just please be patient if we do run into anything. Also, throughout the webinar, we want to hear from you. That's the whole point of this. We're here for you. If you have any questions, please feel free to let us know through the Q&A feature at the bottom of the screen. So to find it, what I'll have everyone do, or what I'll ask everyone to do, is please just toggle down, move the mouse down to the bottom of the screen. You will see a Q&A option pop up. This is where we want you to put all those questions. We'll do our best to address as many of them as we can during the webinar. It is best to put the questions in the Q&A section. If you put the questions anywhere else, there is a chat function. We ask that you put them all, again, in the Q&A section. So if they go into the chat, we may not be able to get to them during the webinar. For those of you who are watching us through YouTube Live, we are monitoring the comment section there as well, so please feel free to type your questions in. Lastly, there will be times when multiple panelists will be on the screen at once. For the best viewing experience, please select gallery view at the top right corner of your Zoom screen so that you'll be able to see multiple panelists at one time. I'm going to take a second to go over that with you guys one more time. So top right, you'll see a view with a couple squares. If you click that, you should have the option for gallery view. We ask that you please keep it in gallery view so you can see all of us pop up if and when we are all on the screen. All right, so let's talk a little bit more about our goals for the day and what we'll be covering. Awesome. Okay, so first goal of the day, we're going to review common running injuries. The second one is we're going to explain running mechanics that can cause pain or injury. And then lastly, we're going to discuss the factors and training errors that can lead to this. We're going to talk a little bit about load and capacity. And finally, we will be answering your questions live at the end of this webinar. Okay, before we get started, I would like to introduce our team of panelists. So let's bring everyone onto the screen if we could, please. Awesome. There we go. All right. So let's introduce Amanda Kalan from 16th Street, our 16th Street's Chelsea location. How's it going, Amanda?
Good. Hi, everyone.
And it's Amanda Kalan. I'm sorry. I've been practicing last names. I'm horrible. So Amanda Kalan.
All good, Austin.
Let's introduce Lauren Bachner as well. Lauren is with us from the 16th Street location and is a physical therapist there as well. How's it going, Lauren?
Hi, everyone.
And lastly, we have Michelle Rooney, who is a physical therapist and also the clinic director at our 16th Street Chelsea location as well. How's it going, Michelle?
Well, Austin. Hi, everyone.
Michelle will be in the background helping with the Q&A today. Just one more reminder for everyone out there. It is best to be in gallery view so that you can see all of us at the same time. So you should be able to see all four of us. If you've done that, again, all four of us should be there. If not, top right corner, it should say view. Do us a favor, click that, select gallery view so you can see all of us. Okay. All right, let's get started. So Michelle and I are going to say goodbye for right now. Amanda and Lauren, I'll let you take it from here.
Alrighty. Hi, everyone. So to get started today, we just wanted to start with a quick poll to get everyone ready for our topic today. So it should pop up on your screen, and I'll kind of go through that with you guys. So what I kind of want to dive into is what you guys think is really the most common running injury. So it can be patellofemoral pain, IT band syndrome, Achilles tendonitis, or stress fractures, or we can really kind of look at them as maybe they're all pretty common. So whatever you guys think, just jot down an answer really fast. I'll give you a couple seconds. Awesome. So great job. So it can really much be all of them. So now Lauren's going to dive a little bit deeper kind of into these topics to get started.
So I'm going to talk a little bit about patellofemoral pain. So this is pain on or behind the knee that is aggravated by an activity that includes loading the knee joint during increased weight bearing on a flexed knee. An example of this are squatting, going up and down stairs, jogging and running, and hopping and jumping. A common question is what causes the pain? The ground pushes back on the foot with a force of about 2.5 times your body weight that transmits up to the lower extremity to the knee joint. This is known as the ground reaction force, resulting in the quad compressing on the patella with forces of about 4 times your body weight. The main treatment usually includes focusing on the patellofemoral joint anatomy, observing if there's maltracking of the patella, so going in or out, testing if there is a decreased quad function, if there's altered hip, knee, and foot mechanics or muscular imbalances or tightness. The conclusion is you must not lose sight of how strength, kinetics, kinematics interact with training loads and non-mechanical factors. The next one I'm going to talk about is IT band syndrome or iliotibial band. So this is on the outer part of your thigh. This is a thick band of fascia or tissue that begins at your pelvis and runs down the outside of your thigh and crosses over the knee joint. Iliotibial band syndrome is an inflammatory condition of the knee that often attributes to the IT band rubbing across the lateral femoral condyle, which is on the outside of the knee, or compressing the tissue between the lateral epicondyle of the femur and the IT band, so right on the outside of your knee. The last one I'm going to talk about is stress fractures. This is a small crack or bruising in the bone. It's common in overuse injuries, so a lot of runners will experience this. When a muscle becomes fatigued and it's unable to absorb the added shock that is associated with running, and the fatigue muscle then transfers the overload of the stresses to the bone, which causes these tiny cracks. Symptoms usually are pain that gets worse the more you run, sharp pain that you can pinpoint to a bony area, and swelling on the top of the outer portion of your ankle. Amanda is going to kick off talking about some biomechanical running errors that may contribute to these 3 common running injuries.
Awesome. So now you guys are pretty familiar with some of the common running injuries. We want to look at certain factors that could be causing your pain or injury. So we need to first address what's called cadence. So cadence is defined as a number of steps that you take per minute. It has been shown that in runners, if you have a higher cadence, you usually have a smoother running or what's called a gait pattern. while runners with a lower cadence are more likely to overstride or have their feet land further out in front of their body, which can increase the shock as you're landing. Or it can also cause you to bounce a little bit more up and down. So now kind of begins the question of what really is that ideal cadence that we're looking for when you're running. So studies have shown that a cadence of 180 steps per minute, plus or minus about like 10 or so, is really the ideal cadence for runners. So a high cadence of about 180 has been shown to decrease your oxygen consumption, really decrease the impacts that you have as you're putting your foot on the floor, decrease the amount of work that your muscles are doing, and kind of help decrease that vertical displacement or the amount that you bounce up and down, which then equals a lower risk of injury. A lower running cadence or lower steps per minute of about 140 or 160 really increases the forces as your foot strikes the ground. It also increases the angle at which your foot strikes the floor and can also increase the reaction of impact back up to your body and your joints as you're striking the floor, which can then cause a higher risk of injury. So we're all probably wondering what our cadence really is. So to measure that, you can count the number of steps that your left or right foot hits the ground in 30 seconds. Then you're going to double it to get a total of 60 seconds or a minute, and then double it again to get the total for both of your feet. A lot of our Apple Watches or Fitbits or any really wearable technologies kind of have the ability now to help measure your cadence as well. So if you've measured your cadence when you're out for your next run and you see that it's on the lower side, one really great way to kind of help change your speed is to use Spotify. So Spotify has a running section when you just type it into the search bar that has songs with a beat that measure to the same cadence that you should be running at. So you can go in and look for the ones that say like 175, 180. And then the next time you go for a run, just throw on some good music and kind of just let the beat take you through your run. The next one that I want to discuss is called vertical displacement or oscillation. So this is how much your torso or your body bounces up and down as you're running. This is pretty hard to measure yourself. There's a lot of specific tools or gait analysis that you can use if you really want to get specific on it. Most of us tend to measure between 6 to 13 centimeters. So you really want your vertical displacement or the amount that you bounce up and down to be on the lower side. This helps decrease the amount of energy that you're using as you're running. So basically, as you decrease the amount that your body goes up and down, you'll be able to move, it will take less energy to move you up and down, and then you can use that energy to push you forward instead. So the last one I want to talk about is also called a foot strike. So you can see on the screen on the PowerPoint that there's 3 different types of foot strikes. That is where either your foot or your toes contact with the floor that you're running on. So the 3 types I want to talk about, the first one is called a rear foot, or when your heel contacts the floor. The second one is a midfoot, where basically the middle of your foot contacts the floor. And the third one is forefoot, where your toes or the ball of the foot contact the floor. When trying to choose between what kind of strike is correct or might be the best, it kind of really depends on each runner or patient themselves. There really isn't one that's better or the other kind of when you're choosing on it. Runners who run with a heel strike or that rear foot strike tend to have more force through their knees and not really on their ankles, where midfoot and forefoot strikers tend to land on their balls of the feet. They might have a little bit more issues with calf strength, and that kind of then triggers forces more to their ankles. So switching between a 1 foot strike to another doesn't really help you prevent injuries or absorb shock. It just kind of relocates the way that your force is impacting on your body. So kind of the bottom line, should you really switch your foot strike to prevent the injury? It kind of depends. If you suffer from knee pain, maybe kind of think of switching to a forefoot or a midfoot, where if you suffer from ankle pain, maybe kind of think of switching to the heel strike. You're not really experiencing any pain currently that you're really noticing through your running mechanics, there's really no reason to change how you're striking your foot at all. And then what we're going to do next is Lauren's going to kind of help run you through some of the next ones as well.
So if you look at the next screen, you're going to see 2 other common running errors. This is the one on the on the right is going to be known as knee window. So this is the presence of space between the knees at all parts of the running cycle. Absence of this space is known as crossover. So when you're landing, your foot crosses over the midline of your body. If you're impaired, you'll see excessive hip adduction and internal rotation in knee valgus. So this is just the fancy way of saying the crossover. And this can be seen in the picture on the slide. Keep in mind, you do not want excessive space between your legs either while running. You just want to see that there's enough space between. A relatively small knee window will cause decreases in step width and cause increased IT band strain, which can potentially lead to IT band syndrome, as we discussed before. The one on the left is known as pelvic drop. So this is that uneven drop of the hips when walking or running due to hip and core weakness. A hip drop occurs when the body is unable to provide adequate stabilization while we are being supported on a single leg, as this occurs during the stance phase of running. Excessive pelvic drop causes excessive hip adduction, or the crossover we talked about, which has been linked to several running injuries. Amanda and I are now going to test you guys to see if you really can know what we're talking about in regards to biomechanical errors we just discussed.
So we're going to play 2 videos for you guys. I'm going to go over the one first, the video on the left. That was my patient in the orange shirt. So as you're looking at the video, I kind of want you to just take a look at their running forms, what you're seeing, and kind of seeing if anything that we might have discussed in the previous 2 slides is really occurring in how our 2 patients are running. So the first poll just popped up for you. This is going to be based off of the video on the left, or the girl in the orange shirt. And I kind of just want to see what you guys see going on. Do you see any vertical displacement kicking in? Do you see, I know it's a little bit hard to see kind of from the side view, if she has an increased or decreased knee window, how is she striking the treadmill as she runs? Or are you guys really seeing all of these go on? So just take a second, take a quick look at the video, see what you guys are looking at. All right, so it seemed like most of you guys are correct with that rear foot strike. So you can see as she strikes the treadmill, her heel is pretty much the first thing that's coming in contact. You can also see a little bit of increase of vertical displacement in the way that she's bouncing pretty far up and down. If you kind of were to draw that line through her hips or from her trunk, you'll see she kind of bops herself up and down. So she could definitely use a little bit of that energy to push herself forward a little bit more. And then you can also see a slight decrease in knee window. It is kind of hard to see from the side view. Looking a little bit more from the front or the side would be a better depictor of that knee window, but good job with that one. And then Lauren will run you through her patient on the right.
So my patient's the one in the black. You can do the same exact thing Amanda just did, kind of look at what you think you see. I know it's kind of hard to see if there's a knee window, but let me know if you think there's vertical displacement, a decreased knee window, or a midfoot heel strike, or all of the above, and just in regards to the impairments that you see. Okay. So she does have midfoot heel strike, so that's not too much of an impairment. I would say that her vertical displacement, she has a little bit of bouncing, and then her knee window, you're not really able to see. She had a little bit of a decreased knee window, but overall, good job, guys. So now we have discussed some common injuries due to running, form and muscle imbalances. We wanted to show you some of our favorite exercises and stretches to help improve some of those imbalances you may be experiencing. We'll be providing a handout with these exercises, so don't worry if you can't remember them.
All right, so I'm going to run you guys through some of my favorite exercises to kind of go over for some of the hip and knee patients that I have. So we're kind of just going to drop this down a little bit. So you'll see that I have my step back here. So the first one I like to show patients is just called a step up or a forward step up. So you'll have a box or a step or a stair in front of you. Your one foot or leg that you're working on is going to go onto the step and the other one will step off. You're going to lean your body forward just a little bit. The leg that you're working on, all of your weight will push through that leg. You're going to push down through the heel on that leg. So you feel the glutes on that side start to kick in. You're going to push down through the heel and you're going to step up onto the step. What's really important with this one is you're trying to keep your knee from driving forward over your toes. So you don't want to be totally over the step as you're stepping up. You want to have a nice open chest. So you're stepping up on that leg and then stepping back down. That's really going to help strengthen the quads on that side and the glutes as well, which can overall kind of help to decrease any of that knee or hip pain that you're probably feeling due to some of the common injuries that we went over. Another one that you can do still using the step is if you already have that leg on the step, that leg that you're working on can stay on the step. The other leg is going to be reaching behind you off of the step. You're going to bend a little bit at the knee and a little bit at the hip and lower yourself down so that other leg is just tapping the floor. So you're not accepting weight through that leg. It's just nicely tapping your toes onto it. And then you're going to bring that leg back up to the step. So all of the weight stays on this side. You're going to step down through that leg on here. You'll feel that in the glutes and the quads start to kick in. And then you will step back onto the step. The third one that you can do with your step that I like to work on is going to work all of the muscles on the outer part of your hip right here. So we'll be working on this leg. So this leg will stay on the step and the other leg is going to be hanging off of the step. As you have that leg on your step, what we're working on is strengthening all the muscles over here. So any hip or knee injuries that you're having will definitely help. Working on this outer portion here will kind of help decrease anything that's going on. So this is called a lateral step down. So the weight will be on that leg that's on the step. All of your weight will be kind of just hanging off of here. Hands can go on your hips or across your chest, whatever feels comfortable. You are going to bend the leg that you're standing on at the knee and a little bit at the hip. With that other leg, it's just tapping down to the floor. You're going to try and tap that heel down onto the floor. So you're going to bend at the hip, bend at the knees, tap that heel down and pop back up. What's really important is that as you're doing it, your hips are not dropping this way and your knee is not driving inwards. So you want to keep a nice straight line between both your hips. You should feel it all in that glute and on the outer side here. You'll step yourself down, you'll tap, and you'll pop yourself back up. So those are three really fun ones that I like to do on the step. If those feel too easy for you, you can always make it a higher step. You can make it a lower step, however it feels. What you can also do if they feel a little bit too easy is now kind of add the addition of a forward and a lateral step up together. These are called crossover step ups. So if we're starting with that outer leg, it's going to come across the other leg and you'll put that foot on the step. You will then use this leg to push yourself up and the other leg will step onto the step. Then you're going to shift all of your weight onto the other leg and come back down off the step, putting the other leg behind you. This really helps work on glute and hip strength, all the glutes on the side, as well as the quads as well. Just want to make sure, again, your knees are not driving over your toes, you're not leaning forward as you're doing it, and that you're keeping a nice level hip and stable core as well. So the next exercise I like to do is I kind of drop this down. If you have a band at home or anything like that, you don't have to use a band if you don't have one, but if you do, it's going to go right above both of your knees. And then you're going to be lying on your side with your knees a little bit bent. So kind of in this position, you can be lying all the way down or come up on the elbow. These are called clamshells because your knees are going to open up like the mouth of a clam. So you're going to make sure that your knees and your hips are nice and in a line. Your feet are going to stay together and that top leg is going to open up against the band and back down. What's really important to focus on is that as you're opening up against the band, you're not rolling your hips backward with the band. So I like to take that top hand and kind of just place it behind my butt or my hips on that side and kind of just roll my hips a little bit forward so they're pointed a little bit down towards the floor. You are then going to open up again and you'll really feel all the glutes and the hip muscles on that upper side really start to fire and kick in. So those are just some good exercises if you guys want to start working on those glutes and quad muscles. And then Lauren's going to run you guys through some stretches as well.
Hey guys, so I'm gonna move my camera down to here, so hopefully you guys can see me. The first stretch I'm gonna show you is known as the piriformis stretch. So this is a little tiny muscle that's on your butt. It tends to get pretty tight. So what you're gonna do is you're gonna lay down on your back with your legs up like this. You're gonna cross your legs over, so you're almost in like a figure 4 position. Then you're gonna lace your hands underneath the knee and you're gonna pull forward. If you want, you can kind of push on the knee a little bit. You'll feel an extra stretch there. But you can hold this for about 30 seconds. You hold it for a little bit more. So that's the piriformis stretch. And then the next stretch I'm going to show you. I'm going to move this up just a little bit more. So this is going to be the hip flexor stretch. A lot of the time, a lot of runners have tight hip flexors. So what you're going to do is get in that lunge or like half kneeling position. You can put both your hands on your hip. What you're going to do is kind of lunge forward or drive forward, activating your glute on this side. And then you almost want to tuck your tail. So that way you're feeling the most out of this stretch. And you can hold this for about 30 seconds, do it for 3 times, and then you can switch and do the other side.
All right, so we're going to bring our PowerPoint screen back on, and we kind of just want to switch focuses from the running injuries that we kind of discussed, any running mechanics and things like that, and now kind of have the key to really understanding how to manage these running injuries and really understand the balance between 2 terms. So the 2 terms I want to talk about is load and capacity. So when we define these 2 terms, we can define load as a certain stress that is placed on our tissues. So this stress can be the amounts of sets or repetitions you do of an exercise, the amount of weight that you use, how often or how long you exercise, how far you run, where you're running, on the treadmill, track, in the city, all of that type of stuff. Capacity is then defined as how much stress your tissues, muscles, ligaments can really handle before you have an injury. So that's described as what you can do, what your own strength is, any other like psychological or biomechanical factors. We really need to understand the balance between your training load and your training capacity to handle that load. And that's kind of the starting point of where our injuries begin to occur. So you can kind of see on our PowerPoint here, we have that visual of the seesaw, where the one side of the seesaw is a little bit heavier than the other side. So we can see that the heavier side is that training load, the amount of sets, repetitions, our weight, our volume, intensity, all of that stuff. Where the other side, of the lighter side, is what we can really handle, our tissues, our strength, our flexibility, our running mechanics, all of that things. So this seesaw is a pretty common scenario that we're looking at. You've pushed your training on, you've really increased too rapidly of the amount of sets, reps, how often, things like that, more than what your body can handle. And that's where we start to look at the imbalances and what really increases our pain and injury.
So every tissue in the body has a certain capacity. If we only apply a load that is much greater than the tissue capacity, there's a higher risk for pain and injury. If we make adaptations at a slower rate and allow time for the tissue to make those adaptations to the load, the capacity of those tissues will slowly increase, and therefore we will reduce our injury risk. This eventually causes muscles to become stronger and tendons will become more resilient. A common example is when someone starts a new activity quickly. The load is greater than the capacity can handle, so the tissues can get damaged and the capacity goes down, causing some form of injury.
So how do we really avoid overloading our tissues? So we really need to introduce a gradual change. So the question then becomes how, and that's very dependent based on person to person, patient to patient, or really runner to runner. Very generally speaking, kind of based on the research that's out there, we can look at intensity, our weekly mileage, and our terrain. So kind of based on that common research, it's been said to mix about 80% of a nice, slow and easy type of workout or run with about 20% of a high intensity run. It has also kind of been shown, and we'll kind of bring this back a little bit later on, that we should really increase our weekly mileage about 10% when your longest run is about 5 miles or more. So we really need to start looking at how we can balance our load and capacity.
So now that we have balance, we increase the load and capacity at the same time and create a good running program. We must remember that we are more than just mechanics and tissues working to respond to the load. Unfortunately, many people are told their pain stems from biomechanical abnormalities. This can be weak glutes, flat feet, short legs, small knee window, improper heel strike. The list can go on. But many of these discrepancies do not exist. They only lead to small They do not exist, or they only lead to small stresses on the tissue and play a small role in your pain and injury. Of course, it's important to look at those imbalances and address them, but we need to focus on other factors that play a role in recovery, such as stress, sleep, illness, and diet. All of these factors have a link to tissue load capacity, or its ability to adapt to a load and can reduce the capacity and our ability to recover from an activity.
So when we really look at all of these things as a whole, if we want to reduce the risk of injury, we need to try to balance the load with the capacity to handle that load. So again, our training should be structured with a gradual progression. But pain is just more than a problem with our tissues, our strength, and things like that. And Lauren's going to dive a little bit deeper into kind of some other factors that could really affect how we're getting injured, our pain, and our recovery as well.
So like I said before, there's some psychosocial factors that play into the role of how our body will recover. We know how important sleep is and how lack of sleep can affect our bodies mentally, physically, and emotionally. This also applies to our running injuries. Studies have shown that less than 7 hours a day for the span of 2-week period is associated with newer injury risk. And overall, many studies have shown that less than 8 hours a night create a higher risk for injury. Next thing I'm going to talk about is stress. Stress is a major part of our life, and as much as we try to avoid stressors, we cannot always control how they affect us. Prolonged periods of stress that can or cannot lead to depression actually increase the risk for injury by 32%. Running may be your way to reduce stress, but if you have too much stress in your life, you could also be increasing your risk for injury. Lastly, the most common question by patients: what is the best shoe wear to wear for running? There are limited studies supporting a specific shoe brand, but many studies have shown that a minimalist shoe in combination with increased cadence decrease injury risk. Cadence is what Amanda touched upon earlier. A minimalist shoe allows for deeper foot muscles to strengthen, as there is more muscle activation needed to support the foot to decrease support and cushion. These can be the funny shoes that you see people look like they have webbed toes in. Amanda is now going to talk about a topic known as acute to chronic workload ratio, and we will discuss how important this is when talking about running programs.
So I want to bring up a new idea, which is on the bottom of the screen. It's called the acute or chronic workload ratio. So this ratio is now going to become important with probably like the one question that I'm sure everybody is thinking. We want to improve our performance and maximize our workloads, but we want to decrease our injury rate. So how can we improve our performance if the more that we load, the more that we run, we are more likely to injure ourselves? So this is where this ratio really starts to come into play. So when looking at our workloads, we really have to define them as either external or internal. So external is the amount of work that you as an athlete does, like your distance, your speed, and your duration. The internal loads is then your response to the external workloads, your heart rate, how much oxygen you're producing, your rate of perceived exertion, or how hard you felt the workout was, all of those kind of things. Only using those external loads did not really account for the psychological, physiological responses, or those internal training loads that are influenced potentially by stress, sleep, diet, kind of the things that Lauren mentioned earlier.
So when a runner begins a new workload, we need to address fitness and fatigue. High workload leads to high fitness, but can also lead to high fatigue, which can increase your risk for injury. People think to avoid injury, they just reduce their workload, but in reality, this has also shown negative effects on fitness and injury prevention. According to research, the issue with high workloads does not lie in the workload itself, but in one's preparedness for them. Prior research is still current, and still some current research are the 10% rule, stating an athlete should not increase their week-to-week workloads by more than 10%. And while this rule is still in effect in some cases, the acute to chronic workload ratio looks more at an athlete as a whole and their ability to adapt, bringing back that capacity versus load theme addressed earlier in the presentation.
So kind of to define it a little bit more, an athlete's preparedness is known as your chronic workload, usually kind of just a rolling average over the span of the past 4 weeks. Acute workload is then where an athlete presently is, so over your most recent week. So values of this ratio larger than 1 can be associated as a workload spike. An athlete used to a high chronic workload will respond to a high acute workload with increased fitness and decreased injury. An athlete that's not really used to that high chronic workload will respond to an acute workload with fatigue, decreased performance, and increased injury. So for example, if you run 50 miles 1 week, 40 miles the next, 50 miles your 3rd week, and then 60 miles on your 4th week over then the past 4 weeks, to find that ratio, you'll take 60, which is the last week's mileage that you ran, and you'll divide it by 50, which is the average of the 4 weeks, which will be 1.2. That sweet spot that we're looking for that has been shown to kind of help decrease injury has been between 0.8 and 1.3 of that ratio. So this way, athletes can progress to a higher chronic workload gradually with minimal load related injuries. This ratio isn't really like the end all be all, and it's kind of hard sometimes to then manage those external loads with those internal loads. So we really need to look at ourselves more closely to understand that those other stressors that Lauren mentioned earlier can also be affecting our workload response. So that can include sleep, food, the heart rate, but it can also be addressed in what's called your session rate of perceived exertion, or your RPE.
So session RPE, or rate of perceived exertion, is a scale 0 to 10 and basically addresses how hard you thought your workout was. You can go for a 3-mile run on Friday and rate it a 3 out of 10, meaning it wasn't too hard for you. And then you can do the same run on Monday and rate it a 7 out of 10. Why? You could have had to wake up earlier on Monday for a meeting, you skipped lunch because you had to run a last-minute errand, or your big Italian Sunday dinner is still catching up to you. All of these factors influence your workload on a day-to-day basis. The use of an internal training load measure, the session RPE, in combination with external factors, provides a more individualized estimate of a week-to-week changes in overall training stresses, and can overall reduce your injury risk and facilitate a return to run.
So when you really think about it, there's so much more to having pain or becoming injured during your running. When we look at an injury, we need to look at a person or runner as a whole. Running injuries can be stemmed from biomechanical impairments or form-related strength and flexibility issues, having those weak glutes, decreased quad activation or control. They can definitely all be a factor in what's causing your pain. Running injuries can also be seen kind of from the form or running analysis, showing some of those muscular imbalances in a more functional running position that we kind of discussed earlier. And we can kind of help target those specific aspects to decrease the pain as well.
So we also need to look at further at psychosocial aspects, a runner's external load as well as internal load. We need to understand how much load we are placing on the body versus the capacity of our tissues to handle that load. We need to understand that sleep and diet, work and life factors play a role in injury as well. Before we increase our external load, we need to look at our internal load. Using a combination of all these factors we discussed today will help you gauge what your own body can handle and how to successfully prevent injury and keep performing the activity you love to do. So we finished today, and Austin will come back on the screen.
All right, great job, guys. A lot of helpful information in there. There was a lot of good audience participation. I have questions for both of you guys, so let's dive right in. And also feel free to take these how you guys see fit, but let's start with the first question. All right, so there's some questions that were floating around about shoes. So can you help me pick a shoe for running? I feel like there's so many out there. And on top of that, there was a question about the toe shoes as well, if there is a brand. So if I could combine all those, let's talk about, if you guys for a couple seconds could just talk about what's the best way to look for a shoe, what's the best shoe for a runner, and then what brands manufacture the toe shoes.
So I can kind of start with this one. So it's really hard to kind of sit here and say everybody should go get Nike shoes or Adidas shoes or Brooks or things like that, because everyone's foot is definitely different. So kind of when you're just looking at like a general shoe, we want to be able to have one that's going to have some arch support, a little bit of cushion in it, feel pretty secure to your foot, but not where your toe is really banging into it. It should feel just kind of like a neutral support for your shoe. A lot of the research out there is actually done by individual companies saying that this shoe is better than the other shoe. So for us, it's kind of hard to recommend a specific brand for you guys. It's more a little bit of like a trial and error. If we kind of see that you're running and you're having some of that pain, maybe the shoes that you're in now aren't giving enough support to that arch, don't feel as cushiony, or they might feel too hard down to the surface and you're just bearing down load through that as well. So it's just something to be aware of, that shoes can impact, but there isn't like a specific brand or shoe that we really feel that anybody should like 100% go out and buy and things like that. Everybody kind of has their own one that they've looked into, have maybe done a little bit more research, seen a little bit more on that aspect. So it is kind of a little bit of that like patient to patient based and how we would kind of refer to that. For specific like brands of the ones with like the webbed toes, I don't know if Lauren knows a little bit more about that. I'm not 100% sure of like the best brand on that as well. There kind of seems to be a whole bunch of different ones out there. So it's more along the lines of just kind of like jumping on the internet, taking a quick look at what they have through just like some standard websites, maybe like from Runner's World or at Jackrabbit. And they have a bunch of different brands that would be really beneficial for anybody as well.
Just to go based off of that, I'm not exactly sure about the minimalist shoe, but for other shoes, there are websites that give you options to take little quizzes that you can take to kind of guide you with what kind of shoe, if you need more support or less. A lot of like shoe companies, like I know Asics, Brooks, and some other places do this where like they'll have like professionals kind of watch you walk and see if they see like your foot pronate or come in, or if you supinate and let your feet come out, and they'll try to gear you towards a shoe that most common people will benefit from those.
Awesome. And then I guess real quick, can they come to you guys, or, can they go to a therapist and potentially look at what their foot's doing? And then can we talk to them about potential types of shoes that they should be looking into, or can we help guide them as physical therapists?
Yeah, so definitely. I think that's something that I already do kind of with my patients, and I know Lauren does it as well. We definitely kind of the first thing we'll do when you come in is take a look at your posture, how your feet are, how it looks on your walking, and we'll kind of be able to see, like if Lauren said, if your toes kind of point out, if they point in, if you roll onto the outer portion, if you roll to the middle, if you strike with maybe like the outer portion of your foot or the inner portion, and then that will kind of help us maybe guide a specific shoe that might be better or worse for you, just depending on how your foot is different than the other person as well. So it's definitely something that you can come to us for, to just kind of take a look at how you're walking and moving, and then maybe have like a specific brand or shoe that might work better for you.
Awesome. Let's grab this one question about PFPS, and I smile because we all know that's such a big umbrella term for patellofemoral pain syndrome. So basically knee pain. So do you guys have any specific exercises? Let's just say one for each of you. One exercise go to if somebody is diagnosed with patellofemoral pain syndrome or just has generalized knee pain.
Well, I guess I would start with they're called quad sets. So you put like a little towel underneath your knee and you have them like push their knee into the towel. I can kind of show you a little bit. So if there was like a towel underneath here, you can kind of straighten your leg and you can see my quad kind of turn on. You just want to make sure there's no pain with that. You make sure that the muscle is activating the right way. A lot of patellofemoral pain can be from like the quads being kind of weak. So you want to focus on strengthening those.
I'd say that my favorite for that is probably a wall sit, where your back is against the wall. You basically slide down like you're sitting into a chair. That's really going to help activate the quads because you're going to feel it all in your thighs. It also helps keep your core and your back active as well as you're doing it. I think the most important thing to then realize is to make sure that as you're sliding down the wall, your knees are not driving inwards towards each other. So you're kind of pressing them a little bit more onto the outer portion, keeping them nice and in line with your hips. That's, like Lauren said, is going to keep those quads nice and active as well, which is kind of the main goal for us to kind of work through knee pain.
Awesome. All right. Thanks, guys. Patellar tracking syndrome, or, I know we've all seen those patients where their kneecap's not moving as well as we would like. What do you guys recommend from a stretching, foam rolling, pre-post run sort of routine for them? So I guess if they're having tracking issues with their knee, do you recommend stretching and foam rolling? And if so, do you recommend that they do that before or after the run?
So for my kind of seeing it in the clinic and things like that, I think it is really important to stretch out that quad and foam roll it as well, and the IT band as well, as our patella kind of tracks in where the knee joint sits. It is kind of coming from like quad not activating, not really helping kind of pull the patella into the correct spots that we need it to be. So it does come from strengthening and running, but it is also making sure that the quad itself is stretched out. So the way that our quad tendon attaches to our knee isn't pulling it in any funny directions or anything like that. I'm a big fan of doing it after the run. You've got everything kind of warmed up. It's a really good cool down before kind of then going about any other activities that you're doing throughout the day. So that's just kind of how I would probably structure that type of session.
And I usually do the same. Sometimes I'll have patients like warm up with like dynamic exercise. So some like walking lunges or do some squats before they run and then stretch after. So it's really whatever to warm up the muscle before they start for the run and then make sure that everything's nice and loose after.
Perfect. All right. So I get tenderness on my right foot, so under the arch. Wondering basically how to prevent that. And I know it's a little vague since we know there could be a couple things, but generally if you have some tenderness under your foot where your arch is when you're running or even walking, what do you guys think is going on with there, and what are some things to address that?
So I would think it would be, it's posterior tib tendonitis. So there's a muscle on the inside of your calf that kind of travels underneath your foot and it's responsible for the arch of your foot. A lot of people tend to have like weak areas here. And then when they do any single leg activity or their foot's really working when they're running, it becomes really sore and achy. Just like your hands have like deeper muscles in there, you also have to strengthen the bottom of your foot. So we tend in the clinic to have like marbles. We'll have them pick up with marbles. It's kind of a funny exercise, or like towel scrunches. So you put the towel on the floor and you like scrunch your feet up, kind of like you would if your hand was like this and this was your foot. You're just kind of squeezing, keeping that arch, trying to strengthen it.
And then if it could or might not be posterior tib, it could also be what we call plantar fasciitis, where the muscles on the bottom and that layer of tissue could technically be inflamed, just kind of from like overuse or not really stretching as well. Again, kind of strengthening and stretching all of the muscles on the bottom of the foot. In addition to the ones that Lauren said, we also like to do a lot of balance activities because as you're standing on one leg, the muscles on the bottom of the foot are really active, trying to help keep your toes on the floor, preventing you from falling over, anything like that. So if you have like a pillow or a couch cushion, throw it down on the floor. You can stand on that on one leg and you'll just kind of feel your toes scrunch, trying to keep yourself steady on that surface. And that's really going to help strengthen the bottom of the foot as well.
Awesome. So actually going off of that, so we had a question, while doing all of these exercises, is it okay for us to hold on to something? Will it take away from the exercise, or do you recommend that we hold on to something if we find it too difficult?
So safety is always like our number one priority. So definitely keeping a counter, maybe the couch, a chair, always close to you is definitely a really good starting point. What you can then kind of do is start playing within your own limits. So it's totally fine to hold on to something if you're doing balance or you're trying to strengthen until you feel more secure in what you're doing. Then maybe keep one hand on there instead of having two. Then maybe progress to just having a finger on the surface. As you kind of build up a little bit more of your progression, you'll be able to then tolerate more, and then you won't feel like you need the counter. For starting out, having a surface or something to hold on to is totally fine. And then as you kind of work through it, it will get easier and you won't feel like you need it as much.
Awesome. For running, can you have a stress fracture in the hip?
So you definitely can potentially have something going on in the hip. The hip itself, like the joint of it, is usually not prone to having stress fractures close to it. Usually they're a little bit more in the shins and the foot and things like that. It can probably happen. I'd say it's a little bit more on the rarer side. But that's something just to be aware of. I'd probably lean towards maybe one or another injuries going on, but it could potentially be going on. I don't know if Lauren has seen something more than that.
I typically see them more in like the two bones in like the shin area more than anything. I haven't seen any in like the hip, but it could be a possibility. I think it's just a little less common maybe.
Yeah. I agree with you guys. When that came through, I did see somebody once with a stress fracture in their hip, which there was obviously a little bit more going on with that. So it was a little bit more of a complex case, but for that individual that asked that question, the three of us, it's definitely something that can happen. And if you suspect it, it's definitely a move to reach out to your physician as well. But we can also always assess for that. From a time standpoint, We're going to get to one more question. I do apologize in advance. I know a lot of you were putting some really, really awesome questions on here. Our contact information will be put up in a few short minutes as we close out. So if we don't get to your question, I do apologize. They are really, really good questions, but you will get our email. So please reach out to us. We're happy to address these questions when we receive an email. But let's just pull one more out. Where are we? Okay, so here's a good question. So with these, somebody asked, how many sets and reps do you typically recommend to make an impact in the exercises? So sets and reps.
So I think for stretching, we all pretty much do the same, where it's like 30 seconds, 3 times, like holding it for 30 seconds. Strengthening, I usually do like 3 times 10 to start. And then if it's like they're getting easier, then I'll bump it up to like 3 times 15. So I'm not sure what Amanda usually does, but I think we're all pretty much the same in the clinic.
Yeah, I feel like our golden rule for generalized strengthening is definitely 3 sets of 10. And then once that kind of starts to become a little bit easier, we can then kind of play with strength versus endurance purposes and things like that with our sets and reps and our intensity. But just kind of starting to learn the movement, starting to build up that general strength in the lower extremity or the upper extremity. I feel like we all kind of stick with that, just 3 sets of 10 and make sure everything feels okay. There's no increases in pain and anything like that.
Awesome. Thanks, guys. I know this is always a big topic, especially as the weather's getting warmer and we get a lot of people out there running. So thanks for taking some time to answer those questions. All right, everyone, we hope today's talk was valuable and that you learned more about running-related injuries and ways to address them. Again, if we didn't get to your question, we will do our best to reach out to you directly afterwards. I will ask that you do take our contact information down. That is actually on the screen right now, at least for Lauren and Amanda. We'll also be sending out a handout after the webinar with a recap of important facts as well as the exercises, so you can have that as a reference. So as a reminder, your presenters for today were Lauren and Amanda, who are both up right now, both physical therapists at our Chelsea location on 16th Street. So we're going to leave this slide up for a few seconds. Please take down their contact information. For all of us, it's going to be our first initial and last name at spearcenter.com. So we'll give you a couple seconds to jot that down. All right. And next we'll put up my contact information as well as Michelle, who is in the background helping with some of the Q&As. So again, I'm the clinic director at our Park Slope location in Brooklyn. Michelle is the clinic director at the Chelsea location where Amanda and Lauren are both are. So take a few seconds. Feel free to take our contact information down as well. All right. So lastly, at Spear, we treat an array of conditions from head to toe, and our clinics are open and ready to help if you feel like you have any pains associated with running, or if you have pain that's preventing you from returning or starting to run. If you can't make it into a clinic for an appointment, as a reminder, we are open for telehealth sessions as well. Should you feel that you could benefit from individualized guidance and treatment, please don't hesitate to reach out to any one of us individually, and we'll personally coordinate you being set up with one of our team members for an evaluation. Todd is in the background. Todd, if you want to go back, we can talk real quick about the 5K. So we are hosting our first virtual 5K fundraiser, Miles Towards a Movement. So our virtual 5K will be in June. It's a really, really, really important thing for us. What it's going to do is all the proceeds are going to go towards helping support our mission, which is to increase diversity and inclusion within our field of physical therapy. All of you will be receiving an email as well that will that will have some of this information. It will be pretty cool. You'll receive a free t-shirt, a mask, a medal, a digital badge, just like you would if you went into Central Park or Prospect Park to do a 5K run. But it is for a good cause. So please keep your eyes out for that email, read over it. And if you can join us, we would love for you to join us. I'm sure Amanda and Lauren will be running in June for this as well. And lastly, at Spear, we are hosting these webinars. So they're going to be covering a variety of topics. Our emails will go out to give you guys a heads up as to when this is happening, but they are once a month. So please feel free to keep an eye out on the emails, follow us on social media as well, check your inboxes, learn a little bit more about upcoming topics. Again, thank you for spending your afternoon with us. Looks like the weather hopefully held off. It's pretty nice out there. Hopefully this was helpful, maybe get out for a little run. But we hope you enjoyed our webinar today. And from all of us, we wish you the best. Feel free to reach out if you need anything, and be well. Thanks, everyone.